Cal Ripken Jr., Hall of Fame shortstop, talks about the new Eccentron negative resistance trainer from BTE. Hey, Cal.
Hi.
You've spent a lifetime playing sports, being active, and staying in shape, right?
Yes, for as long as I can remember.
If we could ask, how old are you now?
I'm 52 years old.
But I bet you feel like you could get right back in the game.
Sometimes when I watch a game on TV, for the briefest moment, I think maybe I could still play. But when I get up, I feel a whole lot different. You know, when you play a long time, as you play, you feel like you lose your legs. In retirement, it feels like maybe I've lost my legs. My knees, my hips, my hamstrings aren't nearly what they used to be.
So what do you do to stay fit?
Well, I work out a little bit more conservatively now, mostly in the gym.
Like stationary bikes or stair steppers or ellipticals?
Sure, I've used all those pieces of equipment and more. But recently, the folks at BTE asked if I would try out this new Eccentron.
Eccentron, as an eccentric?
That's right. What I learned was Eccentron provides eccentric exercise, and most lower body exercise is concentric, like riding a bike or climbing, which is fine, but it doesn't offer the benefits of eccentric muscle resistance. Eccentric exercises uses negative resistance to build muscle and power and joint stability for better performance in everything from sports to activities people do every day.
So eccentric exercise with the Eccentron delivers superior results?
Definitely. You can watch your progress as you resist the force with your legs. I can certainly tell the difference in my legs. Your leg and glute muscles are working and getting stronger with eccentric contraction.
So what does that do that conventional exercises might not do?
I find that eccentric strengthening improves mobility, stability, and balance, as well as explosive power. And it does it much faster and with less strain on your heart and lungs than conventional exercise can. But if you really want to understand the mechanics and physiology, let me introduce you to Liz. She's a physical therapist and can explain it even better.
Hi, Cal.
Hi, Liz. You can take over, and I'll see you in a couple minutes.
Thanks. In physical therapy, we've known the value of eccentrics for years. But until now, there wasn't a proven technologically advanced device to deliver eccentric therapy for clients. The Eccentron is the most significant advancement in years. It was invented by a team of university research doctors with clinical research funded by the National Institutes of Health. Now, for the first time, the power of eccentrics, or negative resistance, has been harnessed to deliver results that were simply not attainable through conventional concentric lower extremity exercise. And that impacts your entire practice. For geriatric patients, regardless of fitness or function level, clients are capable of producing higher muscle forces than with conventional concentric exercise. So, with the Eccentron, clients can safely increase strength and stability for improved balance, mobility, and decreased fall risk. For cardiopulmonary clients, the energy required for negative resistance is trivial compared to what's demanded by conventional exercise. In fact, 80% less oxygen is needed in resisting versus pushing, so it can provide effective strengthening for patients with low cardiac output, with less demand on the heart and lungs. For athletes, the combination of high loads and high reps provides performance athletes a volume of work they can't easily replicate in any other way. The Eccentron helps develop the muscle spring of plyometrics without the high force impact. And for general rehab and conditioning, with eccentrics, the human body can resist 30 to 40% more weight than with push or concentric motion. This allows clients to build greater strength and muscle mass in less time. The Eccentron software guides users in determining challenging targets and seeing progression towards their goals. The Eccentron is changing physical therapy, and that can change your practice. Treat a range of patients from frail to high performance with the same breakthrough technology. Perform prehab, rehab, prevention, and conditioning. Attract more referrals and motivated clients, and deliver better, more measurable results as the leader in your field. And you can create real positive results for all of your clients. Cal, back to you.
Thanks, Liz. I've tried the Eccentron. I've used it. I felt the difference it can make. I can tell you, if you use the Eccentron, you'll harness negative resistance for better patient outcomes and better bottom line outcomes for your practice.
So Cal, if you use the Eccentron, maybe you could come back and play ball again.
Well, I don't know about that. but it helps me stay active, stay on the field, and even play a little ball with my son. Check out the Eccentron from BTE. Like they say, with Eccentron, negative is the new positive.